Welcome to our deep dive into hematology, the branch of medicine dedicated to the study of blood and its disorders. Blood is a vital fluid that circulates throughout our bodies, delivering oxygen, nutrients, and removing waste. Hematology encompasses everything from the formation of blood cells to their function and the diseases that can affect them. Understanding blood is crucial for diagnosing and treating a wide range of health conditions. In this video, we'll explore the basics of blood, its components, and common disorders, setting the stage for a comprehensive journey into this fascinating field. Blood is composed of several key elements: red blood cells, white blood cells, platelets, and plasma. Each component plays a unique role in maintaining our health. Red blood cells transport oxygen, white blood cells defend against infection, platelets help with clotting, and plasma carries nutrients, hormones, and waste. The balance and function of these elements are essential for overall well-being. By understanding these components, we gain insight into how blood disorders can disrupt normal bodily functions and why hematology is so important in medicine. Red blood cells, or erythrocytes, are the most abundant cells in our blood. Their primary function is to carry oxygen from the lungs to tissues and return carbon dioxide for exhalation. These cells contain hemoglobin, a protein that binds oxygen. The shape and flexibility of red blood cells allow them to navigate through tiny blood vessels. Disorders affecting red blood cells, such as anemia, can lead to fatigue and other health issues. Understanding their role is fundamental in hematology and helps us appreciate the complexity of blood. White blood cells, or leukocytes, are the defenders of our immune system. They protect the body against infections and foreign invaders. There are several types of white blood cells, each with specialized functions such as neutrophils, lymphocytes, and monocytes. When the body faces an infection, white blood cells increase in number and activity. Disorders like leukemia or immunodeficiency can severely impact their function, making hematology essential for diagnosing and managing these conditions. Platelets, also known as thrombocytes, are small cell fragments that play a crucial role in blood clotting. When a blood vessel is injured, platelets gather at the site, forming a plug to stop bleeding. They release chemicals that help form a stable clot, preventing excessive blood loss. Disorders like thrombocytopenia or hemophilia can disrupt this process, leading to dangerous bleeding or clotting issues. Hematology helps us understand and treat these conditions, ensuring proper clot formation and healing. Plasma is the straw-colored liquid portion of blood, making up about 55% of its volume. It consists mainly of water, but also contains proteins, hormones, electrolytes, and waste products. Plasma serves as the transport medium for nutrients, hormones, and waste, and plays a role in maintaining blood pressure and volume. Disorders affecting plasma, such as clotting factor deficiencies, can have serious health consequences. Hematology examines plasma to diagnose and manage these conditions. Hematopoiesis is the process by which blood cells are formed in the bone marrow. Stem cells in the marrow differentiate into red blood cells, white blood cells, and platelets. This process is tightly regulated to ensure the right balance of each cell type. Disorders of hematopoiesis, such as aplastic anemia or myelodysplastic syndromes, can lead to serious health problems. Hematology focuses on understanding and treating these disorders to restore normal blood cell production. Anemia is one of the most common blood disorders, characterized by a deficiency of red blood cells or hemoglobin. This leads to reduced oxygen delivery to tissues, causing fatigue, weakness, and shortness of breath. There are many types of anemia, including iron deficiency, vitamin B12 deficiency, and sickle cell anemia. Hematology plays a key role in diagnosing the underlying cause and guiding treatment, which may involve dietary changes, supplements, or medication. Leukemia is a type of cancer that affects the blood and bone marrow. It involves the uncontrolled growth of abnormal white blood cells, which interfere with normal blood cell production. Symptoms include fatigue, frequent infections, and easy bruising. Hematology is essential for diagnosing leukemia, determining its type, and guiding treatment, which may include chemotherapy, radiation, or stem cell transplantation. Early detection and specialized care are crucial for improving outcomes. Lymphoma is a blood disorder that affects the lymphatic system, which is part of the immune system. It involves the abnormal growth of lymphocytes, a type of white blood cell. There are two main types: Hodgkin and non-Hodgkin lymphoma. Symptoms include swollen lymph nodes, fever, and weight loss. Hematology helps diagnose and treat lymphoma, often using chemotherapy, radiation, or immunotherapy. Understanding lymphoma is vital for managing its impact on health. Hemophilia is a genetic disorder that impairs the blood's ability to clot. It is caused by a deficiency of specific clotting factors, leading to prolonged bleeding after injury. People with hemophilia may experience spontaneous bleeding into joints and muscles. Hematology is crucial for diagnosing hemophilia and managing treatment, which often involves replacement therapy with clotting factors. Early intervention and careful monitoring are essential for preventing complications. Thrombosis occurs when blood clots form excessively, blocking blood vessels and disrupting blood flow. This can lead to serious conditions like deep vein thrombosis, pulmonary embolism, or stroke. Hematology investigates the causes of thrombosis, such as genetic factors, lifestyle, or underlying diseases. Treatment may involve anticoagulant medications and lifestyle changes. Understanding thrombosis is key to preventing life-threatening complications and maintaining vascular health. Sickle cell disease is a genetic disorder where red blood cells become misshapen and rigid, resembling a sickle. These abnormal cells can block blood flow, causing pain, organ damage, and anemia. Hematology is essential for diagnosing sickle cell disease and managing symptoms, which may include pain relief, blood transfusions, and medications. Advances in hematology have improved the outlook for patients, but ongoing care is necessary to prevent complications. Thalassemia is an inherited blood disorder that affects the production of hemoglobin, leading to anemia. There are different types ranging from mild to severe. Symptoms include fatigue, weakness, and bone deformities. Hematology helps diagnose thalassemia and guide treatment, which may involve blood transfusions, medications, or bone marrow transplantation. Early diagnosis and proper management are crucial for improving quality of life. Plastic anemia is a rare disorder where the bone marrow fails to produce enough blood cells. This leads to fatigue, increased risk of infection, and bleeding. Causes can include autoimmune diseases, toxins, or certain medications. Hematology is vital for diagnosing aplastic anemia and managing treatment, which may involve immunosuppressive therapy or bone marrow transplantation. Early intervention can improve outcomes and reduce complication. Myelodysplastic syndromes, MDS, are a group of disorders caused by poorly formed or dysfunctional blood cells. These syndromes often progress to leukemia and are more common in older adults. Symptoms include fatigue, infections, and easy bruising. Hematology is essential for diagnosing MDS and guiding treatment, which may involve supportive care, medications, or stem cell transplantation. Early detection and specialized care are important for managing these complex disorders. Polycythemia vera is a rare blood disorder where the bone marrow produces too many red blood cells. This increases blood thickness and risk of clotting. Symptoms include headaches, dizziness, and itching. Hematology helps diagnose polycythemia vera and manage treatment, which may involve blood removal, phlebotomy, medications, or lifestyle changes. Early diagnosis and careful management are crucial for preventing complication. Blood tests are fundamental tools in hematology. They help diagnose disorders, monitor treatment, and assess overall health. Common tests include complete blood count, CBC, coagulation studies, and blood smears. These tests provide valuable information about blood cell counts, hemoglobin levels, and clotting ability. Hematology relies on accurate testing to guide clinical decisions and ensure effective care for patients with blood disorders. Bone marrow biopsy is a key diagnostic procedure in hematology. It involves taking a small sample of bone marrow to examine blood cell production and detect abnormalities. This test is crucial for diagnosing conditions like leukemia, lymphoma, and aplastic anemia. Hematology uses bone marrow biopsies to guide treatment decisions and monitor disease progression. The procedure is safe and provides essential information for managing blood disorders. Blood transfusion is a common treatment in hematology for patients with anemia, blood loss, or certain disorders. It involves transferring healthy blood or blood components from a donor to a recipient. Hematology ensures compatibility and safety during transfusions, minimizing risks of reactions or infections. Blood transfusions can be life-saving and are carefully monitored to provide the best outcomes for patients. Stem cell transplantation is a major advancement in hematology, used to treat disorders like leukemia, lymphoma, and aplastic anemia. It involves replacing diseased bone marrow with healthy stem cells, restoring normal blood cell production. Hematology carefully selects donors and manages the transplantation process to ensure success. This treatment offers hope for patients with severe blood disorders, but requires specialized care and monitoring. Genetic testing is increasingly important in hematology for diagnosing inherited blood disorders. It helps identify mutations responsible for conditions like sickle cell disease, thalassemia, and hemophilia. Hematology uses genetic information to guide treatment and provide personalized care. Advances in genetic testing have improved diagnosis and management, offering new possibilities for patients and families affected by blood disorders. Immunotherapy is a cutting-edge treatment in hematology, especially for blood cancers like lymphoma and leukemia. It uses the body's immune system to target and destroy abnormal cells. Hematology incorporates immunotherapy into treatment plans, offering new hope for patients with difficult-to-treat disorders. This approach is revolutionizing care, improving survival rates, and reducing side effects compared to traditional therapies. Anticoagulant therapy is used in hematology to prevent and treat blood clots. Medications like warfarin, heparin, and newer agents help reduce the risk of thrombosis and stroke. Hematology monitors therapy closely to balance clot prevention with bleeding risk. Proper management ensures patient safety and effective treatment, making anticoagulant therapy a cornerstone in the care of blood disorders. Iron therapy is a common treatment for iron deficiency anemia. It involves supplementing iron through diet, oral medications, or intravenous infusions. Hematology assesses iron levels and guides therapy to restore normal red blood cell production. Proper iron management is essential for preventing complications and improving energy levels in patients with anemia. Vitamin therapy is important in hematology for treating deficiencies that affect blood cell production. Vitamins like B12 and folate are essential for healthy red blood cells. Hematology identifies deficiencies and prescribes supplements to correct them. Proper vitamin therapy prevents anemia and supports overall health, making it a key aspect of blood disorder management. Monitoring and follow-up are crucial in hematology for managing blood disorders. Regular blood tests, physical exams, and symptom tracking help assess treatment effectiveness and detect complications early. Hematology emphasizes ongoing care to ensure patients maintain optimal health and prevent relapses. Consistent follow-up is key to successful long-term management of blood disorders. Patient education is a vital part of hematology. Understanding blood disorders, treatment options, and lifestyle adjustments empowers patients to manage their health. Hematology provides resources and support for patients and families, helping them navigate complex medical information. Education improves adherence to treatment and enhances quality of life for those affected by blood disorders. Research in hematology is constantly advancing, leading to new treatments and improved outcomes for blood disorders. Innovations in genetics, immunotherapy, and stem cell transplantation are transforming care. Hematology professionals stay updated on the latest developments to provide the best possible treatment. Ongoing research offers hope for better therapies and cures in the future. Hematology is a dynamic field that plays a crucial role in understanding and treating blood disorders. From basic blood components to complex diseases and cutting-edge therapies, hematology offers hope and improved quality of life for millions. As research continues, new discoveries promise even better care. By staying informed and proactive, patients and healthcare providers can work together to manage blood disorders and embrace a healthier future.